Gout is a complex and painful form of inflammatory arthritis characterized by sudden, severe attacks of pain, swelling, redness, and tenderness in one or more joints, most often in the big toe. It is caused by the accumulation of urate crystals in the joint, which leads to inflammation and intense pain. These crystals form when there are high levels of uric acid in the blood, a condition known as hyperuricemia. Causes and risk factors. Uric acid is a natural waste product that is produced when the body breaks down purines, substances found in certain foods and drinks like red meat, seafood, alcohol, especially beer, and sugary beverages. Normally, uric acid dissolves in the blood and passes through the kidneys into the urine. However, if the body produces too much uric acid or the kidneys excrete too little, it can build up and form sharp, needle-like crystals in joints or surrounding tissues, triggering a gout attack. Risk factors include genetics. A family history of gout increases the risk. Diet. High intake of purine-rich foods, alcohol, and sugar-laden drinks. Medical conditions. Obesity, hypertension, diabetes, kidney disease, and metabolic syndrome. Medications. Certain drugs, such as diuretics, water pills, low-dose aspirin, and medications used to treat high blood pressure or organ transplants, can raise uric acid levels. Age and sex. Gout is more common in men than women, though women become more susceptible after menopause. Symptoms. The hallmark of gout is a sudden, intense pain in a joint, commonly the big toe. Symptoms typically appear at night and can be so severe that even the weight of a bed sheet may feel unbearable. A gout attack can last from a few days to weeks, and subsequent episodes may occur more frequently or involve other joints. Common symptoms include intense joint pain, especially in the big toe, ankles, knees, elbows, wrists, or fingers. Swelling and redness around the joint. Warmth and tenderness in the affected area. Restricted movement due to pain and inflammation. Lingering discomfort even after the severe pain subsides. Stages of gout. Gout progresses through several stages. Asymptomatic hyperuricemia, elevated uric acid levels are present but without symptoms. Acute gout, a sudden gout attack with intense pain and inflammation. Interval or intercritical gout, the period between gout attacks, where no symptoms are present. Chronic tophaceous gout, advanced gout marked by frequent attacks, joint damage, and formation of tophi, hard uric acid deposits under the skin. Diagnosis. Gout is diagnosed through a combination of clinical evaluation, patient history, and diagnostic tests. A doctor may perform a joint fluid test to identify urate crystals under a microscope. Conduct blood tests to measure uric acid levels. Take X-rays to assess joint damage. Use ultrasound or CT scans to detect crystal deposits. Treatment and management. Gout treatment focuses on relieving symptoms during an attack, preventing future attacks, and lowering uric acid levels to prevent crystal formation. Medications. NSAIDs, nonsteroidal anti-inflammatory drugs like ibuprofen or naproxen, reduce inflammation and pain. Colchicine, an anti-inflammatory that is effective if taken early during an attack. Corticosteroids, such as prednisone, can be taken orally or injected into the joint. Urate-lowering therapies, ULT medications like allopurinol or febuxostat help reduce uric acid production. Probenecid, helps the kidneys eliminate uric acid more effectively. Lifestyle changes. Dietary modifications, avoid high purine foods, sugary drinks, and alcohol. Hydration, drink plenty of water to help flush uric acid. Weight management, losing weight can reduce uric acid levels and relieve pressure on joints. Regular exercise, helps overall health and lowers uric acid production. Complications. If left untreated, gout can lead to serious complications such as chronic arthritis, persistent inflammation and joint damage. Tophi formation, lumps under the skin caused by uric acid crystal deposits, which can be painful and disfiguring. Kidney stones, formed from uric acid accumulation in the urinary tract. Kidney damage, from long-term hyperuricemia. Outlook. Gout is a manageable condition with proper medical care and lifestyle adjustments. While there is no cure, effective treatments can reduce symptoms, prevent complications, and improve quality of life. Early diagnosis and adherence to treatment regimens are key to managing the disease successfully. Conclusion. Gout is a painful yet treatable form of arthritis that stems from high uric acid levels. Understanding the triggers, symptoms, and long-term implications is essential for controlling the disease. With appropriate lifestyle changes, medication, and medical supervision, most people with gout can live active and fulfilling lives without frequent attacks.